What happened was the government changed the policy, which really looked at PCTs not being providers but being commissioners. We decided to look at whether we could convince the policymakers as well as the commissioner, the PCT, to let us go along so that we could have some self-determination for our own future. The government and through Alan Johnson and that actually really got behind it at that time, so they created a lot of the levers that allowed us to do it through sort of like working with us. We do everything in our power that the flexibility of leaving the NHS does us to actually maximise the delivery of care that the commissioner and the patients and the people of Hull really need.
Time and time again, the people doing these services in the community said if only we could integrate and kind of be, if you like, more in charge of how we provide those services. Well, this was the way to do it, setting up a community health partnership, but using any money they made to go back into services. So this is totally not for profit, and the workforce actually take a share and own the business. So this was hugely important.
Fundamentally, I was involved right at the very beginning of Evolve when, as a lone practitioner, I was the person working in Hull and the East Riding with people who had eating disorders. We developed a small team that eventually evolved into this day service now.
We've got art groups and self-esteem groups, there's a nutrition group, psycho-ed group. I always say you can design your own recovery here. It's a bit of a line from a James Arthur song which I love, but it's true because that's what we do.
So far, it's been proven that people who have had contact with the service, all areas of their quality of life have improved as a result of their treatment here. So we're very proud of that, really.
We have around 100 children in Hull and East Yorkshire who have Down syndrome. We would liaise with hospital services in Hull and in Leeds. And we're just an important link really for families.
Nathan's quite often very poorly, so I rely on Anna a lot. She's like my lifeline.
When Anna comes in, we don't take her shoes off. She puts her things down, and then she sees what's the matter with me.
Normally my first call, before I ring a GP, before I ring anybody on earth, I ring Anna.
We mainly work with older adults, helping them recovering from some sort of illness or particularly like hip fractures, and they may be in hospital and we actually get them back home.
We was doing an exercise group really where we could, all our patients can intervene with each other, they can get to know each other, sort of come out of the shell a bit really.
Well, what I do is I follow the care plan which is set by the physiotherapist, and I work towards the goals of what the patient wants.
He came with me to see what I could do, and I tried to get up the stairs and he said no, you can't, because I was out of breath.
It's just really nice to get somebody back home with their family, with their loved ones, with the support that's necessary for them to be as independent as possible at home.
Previously, trying to speak to Chief Exec after 30 years in the NHS, forget it, wasn't going to happen. You can actually talk to Andrew Burnell, you can email him, you can text him, you can arrange to meet him. And we've been able to go out on innovations, been able to go and bring in these registrars in special care dentistry, which there's about 19 in the UK at the moment, and we have 4. And that's being seen as a real sort of flag flyer for the UK, which we're very proud of.
CHCP, obviously, the H stands for health. We provided this equipment here. CHCP are the people who have provided us with the money for us to put this in.
Fiona was first involved when I first had my son, so she'd pop round and just explaining about how things go on, because I'd never had a child before. I've never looked after a child or absolutely anything.
As a health visitor, we have a caseload of children ranging from, obviously from 0 to 5. We see women in the antenatal period with information that's passed on from midwifery services. One of the projects that I've been involved with has been the 5 to Thrive campaign, which is asking them to do 5 simple things that helps interaction and brain development. We would help parents to promote that development by giving them tips on speech, potty training, behaviour, just general things to help with child well-being.
Let's Talk provides treatments for people presenting with mild to moderate mental health problems.
Anxiety disorders, which includes like OCD, post-traumatic stress, phobias, things like that.
After the assessment, then what happens is they are referred on to another provider who would be best able to suit their needs.
So they will have sort of 4 weeks worth of this adult education class, and people are encouraged to come, because people often put off because they think it's going to be like group therapy, where you say, "Hi, my name's Dave and I'm suffering from depression." People get really scared about that, so they're very much encouraged that you sit back, relax, you don't have to say anything.
Mental health services in Hull, I think, have come on in leaps and bounds in that last few years, but certainly in the last 2 years. The model that is provided now is an excellent model and is now being nationally recognised.
Obviously the area that we work in within sexual health can be a barrier to people. So some of the things that we've worked on over the year are things such as apps, so people can access the service via an app that they download onto their mobile phone, which gives them information and advice around sexual health, how to access our services. It also advises them on how to access online testing through our Are You Clear website.
The thing that we provide that's different perhaps to some of the big multiples in the 5 pharmacies that we have that are owned by City Health Care Partnership is that we're local, and the people that work for us are local. Our shareholder, if you like, our owner, is local. We're interested in the people that we serve, and we've got a long history of providing those services to them.
It's an absolutely lovely job. You know, you're dealing with very ill children, and it's just lovely to come to work to look after children. It's a really, really close-knit team, and it's just a very nice place to work.
Has he registered with the doctor? Are you registered with the doctor? Yeah.
Of November 1988.
My role is to manage the team of practitioners and our admin support staff to deliver the smoke-free message, so it's tobacco control as well as the smoking cessation aspect.
We came from 3 separate services, so there was an adult section which was based with a charity, there was a young person section which was based with the NHS, and there was a workplace section which was based with the council. So when CHCP took over, we all merged sort of into one.
We provide the therapies for them, whether it be the patches or the gum or the Champix. We provide motivational support as well.
I thought I'll try Champix, see how we'll go with that. I'm having to explain what it does, and some people, it doesn't agree with, but some people it does. And after 2 weeks, I just didn't feel like a ciggy, and I haven't smoked since. So yeah, that was 18 months ago now.
Also, we've got a digital service which is exclusive to CHCP, Quit Buddy and Quit Online service. People can quit via text or via email. And what we found with that is 80% of our users who never ever engage in a stop smoking service are using the digital services now.
And all they do is take a code on their smartphone, present that to the pharmacist, and then receive treatments. So it really does remove a lot of the barriers to a quit attempts.
I feel a debt of honour, actually, to my wife, who was a lovely person, and a debt of honour to the End of Life Services. It was offered to us, really, that Kathy, she wasn't well and she could continue to stay in hospital, but Kathy didn't want to stay in hospital because she said, well, I'm going to die. And although Castle Hill treated her with respect and dignity, and there was no question of that she would like to die at home. Critical to all of this, and absolutely critical to all of this, is Kathy is now gone. But it's important that those people who are left behind, myself as Kathy's husband, but also my children and the extended family, feel that things were done well and that things were done correctly. And somebody needs to say thank you. to the end-of-life services, and somebody needs to celebrate these services, and somebody needs to say this is an exemplification of how it ought to be, how it could be. It could be like this in other health authorities if they make the effort.
Coming up to our 5th year, I can't thank the staff enough for getting behind that vision. This is their company. It's not mine. It's not the directors. It belongs to the people who own the share, which happen to be the staff. And I think that a lot of people particularly get that self-determination now that we always talked about way back, and actually want to keep it. There are so many opportunities. It's just unbelievable when you look for them, and when sometimes they just come knocking every day. It's having the capacity to be able to meet them all.
More and more parts of the country are coming to this now, and they will in the future as well, because the whole future of the NHS is to focus on the community, care in the community.
Well, I couldn't have had better care. If I had to recommend this place, I'd do it 10 times over. I can't say any more, really. They're really brilliant.